For a lot of people, it is about the smile line or the nasolabial fold, which is this area, that bothers them the most. Sometimes it's about age. Sometimes it is about inherent bony structure. With surgical options, which usually means lifting of some sort, like a facelift, the nasolabial fold will never go away completely. And we don't want it to, because it is one of those areas on the face where there is naturalness and expressibility that's very important on the face. What we want to do is we do want to soften it up. And that's the key, is to how do we soften it up? In some people, it's about the transition between a full cheek and a prominent maxilla that causes that nasolabial fold to be deep. So in those patients, what we sometimes do is that we use fillers, but we place the filler deep, right on top of the bone to provide a more smoother transition between the cheek and the maxillary region. A surgical option for that is by placing an implant. It could be actually cartilage or a foreign body. And we go from inside the mouth and we place it right at that transition point between the cheek and the maxilla to provide a more smoother transition. If the nasolabial fold is caused by aging process, and that means sagginess, the reason why the nasolabial fold becomes more prominent when things become more saggier is that a lot of times what's happening is that the cheek fat that used to be higher up drops as we get older. And so this area appears more fuller. The most common way that we address that is non-surgically by using fillers. One of the key things with fillers though is to make sure that we use the right product and we place it in the right region, because it's a very dynamic area. And so an experienced filler injector is that they assess the patient not only with them in a static mode, but also in an expressive mode as well. And that's how we kind of judge and make sure that things are more natural.